My name is Marta. I am the founder and organizer of Get Covered Philly, which is a grassroots campaign to promote the open enrollment period for health insurance that happens every year. Just a little bit about me. I have a full-time position working for a Quaker organization in communications. I also do communications for Women Against Abuse on a consultancy basis. I run a nonprofit Nerds Philly meetup every month at the Free Library. And I'm also a former Peace Corps volunteer. So you can judge from the things that I have done that I'm really drawn to mission-driven organizations that help individuals overcome obstacles through empowerment. So let's find out how that relates to this. And one thing I like to do at the Nonprofit Nerds meetup is encourage everybody to take out their phones, their tablets, anything that they can use to take pictures or share things on social media. We want this conversation to be had, so if you use hashtag #HackingHealthcare, I'll make sure that I retweet those insights that you found particularly valuable later. So just a really quick 30-second history. The Affordable Care Act was passed in 2010. The full name is the Patient Protection and Affordable Care Act. It was signed into law by President Barack Obama, hence the name Obamacare. It had a lot of provisions, and it was a pretty drastic regulatory overhaul. It was the biggest since 1965 with the passage of Medicaid and Medicare. One of the provisions that it created was something called open enrollment. If you're somebody who has an employer that offers benefits, then you know that every year you get that mail from your HR manager saying, please select what insurance you would like for the coming year. For those of us who do not have benefits through our employer or we're self-employed, this open enrollment period is pretty important because it allows us to select an insurance plan for the coming year. All well and good until 2017. The current administration has worked on several occasions to undermine the Affordable Care Act, and unfortunately they decided to set their sights on open enrollment in order to have it take another hit. They did a couple of things that were pretty problematic. For starters, they reduced the marketing campaign for the Affordable Care Act by 90%. So it went from 100 million to about 10 million. To put that in perspective, the state of California alone for its own open enrollment period spent 110 million to let folks know that open enrollment was happening. So pretty drastic. It also cut the enrollment period in half from 90 days to 45 days. I've had a couple of people say to me, 45 days doesn't seem like it doesn't seem like a small amount of time to do this, but if you're someone who, like me, a couple of years ago was working multiple jobs in order to stay alive and pay bills, 45 days is not nearly enough time, especially when you have to look at, well, what am I getting for the price that I'm paying for this insurance? So fortunately, I wasn't the only one who was angry about this, and I noticed that in October 2017, a lot of my friends on Facebook were using congratulations, which seemed kind of weird, but when I took a closer look, I realized they were trying to trick the Facebook algorithm into pushing information about open enrollment to the top of people's timelines. So they were saying, congratulations, did you know that open enrollment is happening from November 1st to December 15th? That's because of all this stuff that is happening. I thought that was a really cool idea, but I wanted to take it in a larger step. I thought, wouldn't it be great if we had not only people posting about this who really care about open enrollment, but what if we got organizations involved? What if we formed partnerships within the city of Philadelphia so that we could really boost this signal and let people know that open enrollment is happening and that it's in terrible danger of being missed by the people who need it most? That's how we got Get Covered Philly. So for our method, since we really started the campaign 2 weeks before open enrollment was due to begin, we focused on a website that had a really awesome navigator directory. Navigators are the folks that you can meet with who will actually help you in person register for health insurance, and a lot of nonprofits and organizations in the city retain them, and that budget was also cut, so we wanted to make sure people were aware of where they could go. We did have a pretty nice social media presence on Facebook and Twitter. We had local partnerships. This picture right here is from Women Against Abuse's Twitter page. I'm a communications consultant with them, but I was also able to use that relationship to boost this signal to their 20,000 followers that they had. We were also really lucky in that we got help from Generosity Philly, and we also got help from KYW News Radio. Without even being prompted, they reached out to us. So since we got a late start, we did learn right away that when we do this again for 2018 to promote the 2019 open enrollment period, we need to do it sooner. So we will be starting this process again in the summer. We're going to be updating our insurance navigators directory. We tried updating it during open enrollment in 2017, and that proved to be a disastrous idea. So we're going to try to plan ahead on that a little earlier. Another thing, and this is information that you can all use if you ever have an event or a volunteer-run initiative, volunteer engagement is going to vary, so have tasks ready that take that into account. Some people want to devote all their free time. They might be retired, they might be a student that has that time. Others might be people who are super busy and say, I want to help, I can't volunteer, but is there something else I can do to further this effort? And then lastly, organizations are much more likely to spread the word for you if you make it as straightforward and easy as possible. One suggestion that had been made to us last year that we didn't get around to doing that we're really hoping we can do this year is talking to health insurance providers in the city of Philadelphia and asking them, can you put a graphic about the open enrollment period on your billing invoices so that people are able to see, oh, hey, I should probably re-up for insurance next year. So little things that we can do to make a big impact. Now, if you have your phones out, since we're running out of time, if you want to take a picture of this slide, these are the best ways that you can get involved, but also think creatively. If you have a podcast, devote an episode to health insurance and the battle to keep the ACA alive. We do have resources on our website so you can contact your elected officials. You can share the open enrollment date right now. It's November 1st to December 15th of this year. Anybody that you know that is going to be vulnerable if they lose their health insurance, now's a good time to casually say, by the way, are you prepared for 2019 because the period for enrolling is shorter? And then here's my email address. You can tweet at me on Twitter. You can contact me via email. You can talk to me afterwards, and I'm happy to give you some business cards. So let's get covered.